The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. We are here for the next episode of TMD Demystified, and I am Tony Urbanek. Today, I'm going to attempt to sort out an issue that is prominent in the temporomandibular joint TMD literature and has been for decades, and seems to be getting more prominent and more common, which is very misleading and confusing when it crosses your path and addresses a problem that apparently, and I say apparently with emphasis, has no solution, and that is the question of, is there one cause or many causes for TMD, TMJ? Now, I'm going to make the case here as briefly as I can that there is only one cause by definition for TMD. But I'm also going to bring to your attention why and how this has occurred, that there is so much emphasis on multiple causes. It really starts out with the concept of cause and effect. You know, what's the cause? What's the effect? The cause of diabetes is insulin deficiency. But the question is, well, what causes the insulin deficiency? What is the anatomical basis for that, the biochemical basis for that? That same concept applies to many, many diseases. As you sort out, well, what's the real cause of diabetes in this case? Insulin deficiency, problems with the islets of Langerhans. But we're going to focus just on TMD. Now, as I've said before, I write a weekly blog in addition to this podcast, which is video, but I write a weekly blog, and I try to keep the topics similar or parallel, the blog going primarily to the public and the episode on Dental Town podcast produced primarily for professionals, dentists. And this week's blog was entitled, Is There One Cause or Many Causes for TMD, TMJ? And again, I'll apologize. I'm going to read verbatim from the blog somewhat, and then go through this to make the case. And hopefully you'll see what's really going on in the literature. I mean, you can read something. Hopefully you can appreciate reading something on a paper or the internet or even a scientific paper that may not really tell the whole story or be confusing as to the way it's presented. But in this case, what I did is I took directly off of the internet 3 examples of answers to the question of, is there one cause or many causes for TMD? And I chose, and I did choose, 3 answers which were populated and published by 3 of the largest, most respected medical groups in the country. The first was how the Mayo Clinic answered the question. The next was how Johns Hopkins answered the question. And the next was how Cleveland Clinic answered that question, which was, is there one or many causes for TMD? And if so, what are they? Is TMD, or another way of saying it, is TMD, TMJ multifactorial or unifactorial? So this is what this is what the Mayo Clinic has to say about that question. The disc erodes or moves out of the proper alignment. When it answers what comes up on the Mayo Clinic website, what causes TMD? The disc erodes or moves out of proper alignment. The joint's cartilage is damaged by arthritis. The joint is damaged by a blow or other impact. Now, it is true that you can damage a joint in many ways, but let's take this as just an example of how things get confused. Is this actually a cause, or is it the effect? If a disc is eroded, and yes, disc can erode, disc can be damaged, disc can be dislocated. Well, what causes the disc to be dislocated? So is the dislocated disc a cause, or is it an effect? Well, actually, it's an effect. It's an effect of chronic inflammation within the joint. The disc gets dislocated because the ligaments that hold it in place get loose under the influence of chronic inflammation. That's a fact. So is the dislocated disc a cause? No, the dislocated disc is an effect. So it's not a cause, so it's not included in a multifactorial cause. The next statement was the joint's cartilage is damaged by arthritis. Well, the joint's cartilage can be damaged, and arthritis by definition is inflammation, arthritis, inflammation within the joint. And then it gets to, well, what causes the inflammation in the joint? And what causes the inflammation, is that the actual cause, or is the chronic inflammation an effect? And the third is a joint damaged by a blow or other impact, and that is true. But the point is, you can have a blow to the jaw joint that doesn't create damage to the joint. It can or cannot create chronic inflammation. But if you do sustain a blow to the mandible, and it does create chronic inflammation, it's chronic inflammation that drives the symptoms. And that's a point I've made many, many times, and I want to make it again. Chronic inflammation drives each and every of the symptoms, each and every one of those symptoms: headache, earache, jaw pain, neck pain, etc. Without the chronic inflammation, you would not have the symptoms. So the chronic inflammation is the common denominator. And the causes, as I've stated many times, the causes of the chronic inflammation are only three. There's only three categories that cause chronic inflammation of the jaw joint. One was just mentioned, trauma, bruxism, which is chronic trauma to the joint, and the third is functional malocclusion, which is chronic trauma to the joint. So basically, they're all traumatically induced, either acute trauma or chronic trauma due to bruxism or functional malocclusion. Those are the only three causes of chronic inflammation. But the common denominator that drives the symptoms, without chronic inflammation, you would not have headaches. Without chronic inflammation, you would not have neck pain. You would not have ringing, fullness, and dizziness. It's the chronic inflammation that drives the symptoms. Now let's take on Johns Hopkins. Now, this is what Johns Hopkins has to say about it, and I hope I'm making the point. These are the most astute, hopefully the most astute answers that are derived off the internet for the public, for your public, for my patients, for your patients. And you can see, whether it be a public or whether it be a professional reading this, how confusing that would be when the question really is, what's causing all the symptoms? So Johns Hopkins says, and it's not a lengthy paragraph, but I'm going to read the whole thing. Johns Hopkins has to say about this: in many cases, the actual cause of the disorder is not clear. Well, they're admitting it's not clear. They're admitting that their answer is going to be confusing, and it is. Sometimes the main cause is excessive strain on the jaw joints and the muscle group that controls chewing, swallowing, and speech. Well, is the effect, is the changes on the muscle groups, is that the cause or is it the effect? Well, actually, it's the effect of the chronic inflammation. So it's not the cause. So it doesn't answer the question. It is not the cause, it's an effect. The strain may be the result of bruxism. Remember, there are only 3 causes of chronic inflammation. So you have to put the cart before the horse. There are 3 causes of chronic inflammation, but there's only one central cause, common denominator. This is the habitual involuntary clenching or grinding of the teeth, but trauma to the jaw, the head, and the neck may cause TMD. Well, you can have trauma to any one of those places, but the trauma has to be trauma to the joint itself. Somehow the trauma to the head or the neck or the shoulders, which is unlikely, being directed into the joint. Now, if you take a traumatic event, motor vehicle accident, a 4x4 off the back of a pickup truck, or as we say here in Tennessee, a beer bottle to the jaw in a bar fight, yes, that can transmit trauma to the joint, which will create damage and will create chronic inflammation. But again, it's acute trauma or chronic trauma, and trauma to the shoulders or the neck is not going to be transmitted directly to the joint. It can cause pain, bruising. You can break your neck with enough trauma, but does it create TMD, trauma to the shoulders or the neck? No, it does not create TMD. Again, you can see how confusing this is from one of the written articles by one of the most prestigious university hospitals in the country. A recent study by the National Institute of Dental and Craniofacial Research identified clinical, psychological, sensory, genetic, and nervous system factors that may put a person at a higher risk of developing chronic TMD. Well, most of those actually are somewhat of a description for stress and anxiety. And we know, the only thing we know about bruxism, it is related to stress and anxiety. We do not know how stress and anxiety gets converted into bruxing the teeth. We know it is a mechanism of some kind within the central nervous system because it is autonomic. It is not intentional, it's not voluntary, but it is autonomic. But to actually describe in the central nervous system, in the area of the brainstem, exactly what's happening, we don't know. And so to say that psychological, sensory, genetic, and nervous system factors may put a person at a higher risk, well, that is true. Those things can cause excess stress. And we know also regarding genetic that TMD is familial. We do not have a genetic, and they say genetic, but hopefully they really didn't mean genetic, because there is no gene associated with TMD that has ever been described. And there's no gene associated with stress and anxiety that I am aware of or has ever been described. So again, they're throwing things at the wall, and they may sound good, but they're not accurate at all. They don't actually portray a truth. And that's what I'm bringing out from one of the most prestigious hospital university teaching programs in the country to answer the question, is there one cause or multiple causes? So they're portraying this as multiple causes, and that is almost exclusively across the board what the literature portrays as TMD, multifactorial. When I've given multiple examples, it's not true. It's not multifactorial. It's unifactorial, chronic inflammation in the joint. And if you can get rid of chronic inflammation in the joint, you will never have the symptoms. If you can, obviously, if you don't have a motor vehicle accident to damage the joint that doesn't create chronic inflammation, you will not have the symptoms. But there are 3 other causes of chronic inflammation, but chronic inflammation is the common denominator. So let's go on to what the Cleveland Clinic has to say about this. This is even more concise. There is no singular cause of TMD. They absolutely state it. There's no singular cause. So they look at it as multifactorial, and that you have all these symptoms, and they can't tell the difference between a cause and effect, a symptom being an effect, and a cause being what causes the effect. It can be the result of many different factors or combination of factors. And they throw out examples. Jaw injury, like a broken or dislocated jaw, we've covered that. Teeth grinding and clenching, bruxism, we've covered that. Arthritis in your jaw, which is basically the equivalent of inflammation. Chronic inflammation basically is arthritis. So on that point, they are correct. It's arthritis of the joint, chronic inflammation. But that's the only factor. The other factors that are listed here cause the chronic inflammation. The next one in line is malocclusion, when your teeth don't fit together exactly as they should. And then they throw out as the last one in line, stress. So we've already talked about that. Stress, we do not know how stress converts into bruxism, but we do know intuitively, by intuitive knowledge, that anxiety and stress creates bruxism. So stress creates bruxism, bruxism creates chronic inflammation, but the common denominator, again, is chronic inflammation. So the true cause of all the symptoms is chronic inflammation, and the others are considerations or episodes or examples that actually create the chronic inflammation. So these were published statements by the most respected medical organizations on the planet. And you can see why there is such confusion. Now, basically, just think about these things again. If you read those again, or you think about what I said again, there is really only one avenue to take if you want to treat this problem correctly, because sometimes you can't avoid the trauma. Sometimes we can't avoid bruxism. There is no way to stop someone from clenching or grinding their teeth. I don't care what the psychologists say or the psychiatrists say or what kind of medication are given, because I have seen it all. Patients have been placed on medication for bruxism. They've been doing talk therapy, all kind of things to relieve stress. And there are ways to relieve stress, but once a person is a bruxer, they are always going to be a bruxer. And under episodes of more stress, they will brux more. And under episodes of less stress, they brux less. But my evaluation is that once a person is a bruxer, whether they start at age 4 or 5, or whether they start in college under the stresses of college life and examinations, once a bruxer, always a bruxer. But it's also admitted that the factors of whether this is what the factors are is unclear. Well, it's very clear. Again, chronic inflammation. So if you want to treat this, it stands to reason that you would want to treat the cause, the common denominator, and not the symptoms. You can't, and as far as what causes chronic inflammation, as I was saying, you can't always avoid trauma. You're not going to avoid bruxism. We don't even know what the mechanism in the brain is that delineates or develops bruxism. And functional malocclusion, you can work on a functional malocclusion, whether it be a large functional malocclusion needing orthognathic surgery in conjunction with orthodontics, or a more minor functional malocclusion that may be treated only with orthodontics or treated only with occlusal equilibration or occlusal adjustment or occlusal reconstruction. Those can be done to decrease functional malocclusions, but you can't always avoid the functional malocclusion to begin with. When you are born with a class 3 mandible growing exclusively, extensively as you go through adolescence, there's no way to avoid that. But you can avoid and treat the common denominator, the chronic inflammation. So what I did discover is chronic inflammation drives all the symptoms. It is the common denominator, and the best way to decrease inflammation within a joint, any joint, the best way, the simplest way, and depending on the kind of joint, but the simplest way on the temporomandibular joint is to just unload the joint. If you had chronic inflammation in the knee, the orthopedic surgeon would likely either prescribe injections in the knee or more likely prescribe surgery on the knee. And if you decline both, he would give you a set of crutches, which would solve the problem by getting the load off the jaw joints. The inflammation would decrease and the symptoms would go away. That is a fact. The same thing applies to an elbow that has chronic inflammation. We've talked about the fact the tennis elbow and TMD are the same disease. It is the same mechanism that drives TMD and tennis elbow, exact same mechanism. I'll let you refer back to prior episodes when I describe that in detail. So the right way, the easiest way to handle a joint that has chronic inflammation is just unload the joint. Now, sometimes it isn't practical to spend the rest of your life on crutches, and it's not practical to spend the rest of your life in a sling if you have tennis elbow, but it is practical. It is very practical to spend the rest of your life using a tool, using a device that unloads the joint by separating the posterior teeth according to a proper protocol. And I emphasize proper protocol because the first question is, if you unload the posterior teeth, which unloads the jaw joints, you can't do that forever because you will get super eruption. But the protocol has been worked out that 24/7 for 2 months in an adult does not cause super eruption of posterior teeth. And that ever after that, it's nighttime or sleep time after that for the rest of the patient's life with a very simple device that disoccludes the posterior teeth, only the anterior teeth occlude without direction of the mandible, any particular direction, which allows the mandible to go back to centric relation, which is in most textbooks also called the rest position. Why the rest position? Because it rests the joint. And when it rests the joint, the inflammation decreases. And when the inflammation decreases, if you have TMD symptoms, the TMD symptoms will go away. So I brought that out again because of it's overused, misinformation. It's just confusing information, confusing the way it's put together. There's no logic to the way these three universities published the answer to that question. Is the cause multifactorial or unifactorial? How many causes cause TMD? Is it one cause or many cause? And hopefully you can see that this is what's in the literature for the public. Now, our own literature, our professional literature, is not a whole lot better. But I picked on this particular issue using these three examples because that is what your patients get to read. And and the doctors themselves, if they want to read something off of the internet without vetting it correctly, will take this to heart and they'll believe what it says because the author is John Hopkins or the author is the Mayo Clinic or the Cleveland Clinic. I really hope I made my point on this. Critical thinking. It comes back to another episode I did entitled Critical Thinking. Please, please, I only ask the listener, the viewer, to think about what I bring to your attention, to see whether it's real to you, whether what I say makes sense. Truly, that is critical thinking, if it makes sense. And a lot of the things in the literature, in our TMD literature, make no sense at all. But it is used constantly, in articles like that I just emphasized. It's used constantly by academics that really are not addressing critical thinking as it applies to TMD. With that said, I'm only repeating myself beyond this. I hope it's made sense to you. I hope it's real to you. I hope you think that my purpose here is to do nothing more than educate and stimulate you to think, in this case, critically think about the issue of, is there one cause or multi-cause, and get away from this almost irreparable concept that's out there because it's so pandemic. It's just across the board. Everybody believes there's multiple causes. No, the common denominator is obvious. I look forward to the next time that I can bring to you another topic, a discussion about the temporomandibular joint, and align with more logical thinking about this problem and get away from the illogical thinking about this problem. Until next time, I am Tony Urbanek, and this is TMD Demystified.